It is Thursday, so in today's KSAT Q&A, we are pleased to be joined by Dr. Ruth Berggren, infectious disease specialist with the Long School of Medicine at UT Health San Antonio. Good to see you, doctor. As always, we got some big news to start with here today. We've learned that Pfizer is looking to get clearance for a third shot. Talk to us about why they are looking for that and what that could potentially mean.
So first, this isn't really a surprise, Myra. We've been expecting to hear news about a booster dose for months. I've talked about it often on this segment, but Pfizer has now announced that they plan to request emergency use authorization for that third dose from the FDA within the month. And it appears that the trigger for this is data. And there's been data from Pfizer and there's been data from the Health Department of Israel, which demonstrates that after about 6 months, you start to see waning immunity, lower levels of antibodies, and some higher reinfection rates. Now, this isn't meant to frighten anybody who got vaccinated more than 6 months ago, like me, for instance. But what we know is that there's a higher risk of a reinfection despite full vaccination if 6 months have gone by since your second dose. And so what they're doing is requesting permission to start administering third doses of the same vaccine. Now, at the same time, they are investigating a changed vaccine that will account for some of the new variants, but that's not what they're asking for this EUA, this emergency use authorization for. They're going after approval to administer a third dose of the vaccine that many of us have had already.
So as we await word on that, we are also now hearing about clusters of people where there are unvaccinated communities across the United States, mainly in the southeastern U.S., including portions of Texas, where people just aren't getting the shot and they're very low vaccination rates. There's some real concerns that those people who are unvaccinated in those communities could impact all of us across the entire nation.
That's true. And so the unvaccinated people who get sick can actually impact the vaccinated people. Why is that? Because the more people that get infected, the more chance that the virus will mutate again and become even wilier at evading immune response. So besides the fact that it could cause surges, which stress our healthcare systems, and that affects everybody, the people who are getting sick from COVID because they're unvaccinated could wind up propagating more resistant versions of the virus. So it's just one of many, many reasons why we want to continue to invite, encourage, and applaud everybody who decides to come and get their COVID vaccine. It's a good thing to do for yourself and for everybody else.
There is some news out of Dallas County, meanwhile, that's grabbing a lot of attention. The health authority there has announced that Dallas County has reached herd immunity, which is a term we talked about so much about earlier on in this pandemic. So when people hear that news, what do you think they should take away from that announcement? And is there any kind of word of caution with that news?
Well, I think anytime a community has gotten more than 70% fully vaccinated, that's what I would call herd immunity. There's full vaccination of 70%. There should be some celebration for sure. But that doesn't mean we throw all precautions to the wind as we continue to see pockets and surges around the country. And remember that there are many people who are very vulnerable. So folks who've had solid organ transplants, kidney transplants, heart transplants, those people are especially vulnerable. People who take medicine that suppresses their immune system because they have an autoimmune disease, like people with rheumatoid arthritis or people with multiple sclerosis, those people are vulnerable even when they've been fully vaccinated. So I think that people need to not just throw all caution to the wind, but continue to encourage vulnerable people to be vaccinated, the people around the vulnerable folks to be vaccinated, and stay tuned, remain situationally aware of what's happening with the variants.
Do you see any point to where the shot might become mandated? I know there's been a lot of concern about people not getting the vaccine, but the federal government has not wanted to wade into the waters of mandating that vaccine. What kind of trouble would that cause? And would it just be easier if businesses and schools were to say, we're going to make it hard for you to do things if you're not vaccinated?
Yeah, I don't envision a federal mandate, and most legal advisors and ethicists don't see that coming either. But it makes a lot of sense for individual businesses and certain industries, like the healthcare industry, to consider very difficult to opt out or true mandates. And there's been a precedent for immunizing people against flu. I mean, if I don't get my flu vaccine every fall, I will lose my admission privileges at University Hospital. So there's a mandate there. We're mandated to get our hepatitis B vaccine. It's really hard to get out of it. And so I think that considering that healthcare providers put vulnerable people at risk every single day, every single time we see a patient, it makes a lot of sense to require such healthcare providers to be vaccinated. Whether it's necessary to mandate that across the board the answer is probably not. But we should continue to educate people about why vaccination makes sense and encourage people to get vaccinated.
We want to get to a viewer question before we go here. We had someone write into us asking that they have heard from other people anecdotally that they've had COVID in the past, so they're not getting the vaccine now. What is your advice on that very topic? What do you recommend?
So we know that immunity from COVID infection can protect you for a time, and we have some data on population levels. We also know, and it's well documented, that there are people who've gotten sick with COVID after about 90 days following the resolution of their first COVID infection. So we know that that can happen. It's well documented. In addition, we have good data from Brazil, where after the first round of COVID infections there, things began to simmer down. And then they got their variant, that P1 variant, which has now been given a Greek letter name. People who had recovered from COVID in Brazil got very sick with the variant. So these are all reasons why people who have recovered from COVID should not rest easy. They should get vaccinated, and they shouldn't really wait more than about 90 days after their first vaccine to go and get that first shot.
All right, Dr. Ruth Berggren, as always, thanks for being here.
Most welcome.
We'll be right back.